All right, so I'm Drew Ligori,
And I'm Nicholas Meyer.
and we did our presentation on mental health during COVID because we believe mental health is a very important topic, not only during COVID, it always has been, but we wanted to emphasize what's been going on during COVID to show you the real effects on people and to show you what it affects because some people don't exactly realize how deep it can go.
And definitely during COVID, there's definitely more stress on people. So what is mental health? Mental health includes our emotional, physiological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Many factors that contribute to mental health problems are biological factors, such as genes and brain chemistry, life experiences. So if you get into like a car accident or now even being in a pandemic, that affects your stress and mental health. Another thing is trauma and abuse. You see like kids now, like if they are abused as a child, they either, they could cause depression when they're older. Family history of mental health problems. And mental health is important to know that mental health is not just for children, young people, but also adults deal with this. It's in every stage of life, and it doesn't matter your age. It will always be there.
Just going off this quick, when Nick mentioned genes and brain chemistry, some people are actually born with a different chemical makeup in their brain, which leads them to this anxiety and, like you said, stress, anxiety, depression. But then some people do pick it up along life, like you said, with trauma and abuse or even family history and life experiences. So that's a great point.
Stress during an infectious disease outbreak. Stress during COVID-19 outbreak has caused many problems to people, some being fear and worry of your own health, the health of your loved ones. So like thinking about, people are dying from this disease. So that's something to worry about. And then you got to worry about your loved ones. It could affect your grandparents, for example. You don't want to see them, not seeing them, because it could actually, they're the ones vulnerable in this situation. Your financial situations or job loss. We found that this is really one of the biggest things during this pandemic that causes stress is people, they're losing their job and they're becoming unemployed. We're going to talk more about that. And a lost support of services you rely on. So another problem that COVID-19 causes is changes in sleeping and eating problems. So, people they either sleeping too long or sleeping too little, and they're not eating enough. Difficulty sleeping and concentrating. We talked about that in my OB presentation. Distractions. There are distractions everywhere. Worsening health, like normal health problems. So like, the gyms weren't open for a little bit. People aren't going out, getting their exercise in, and worsening of mental health conditions, which we're talking about right now. And then we found that all this stress during this, COVID-19, it causes an increase in tobacco, alcohol, and substances use of it. We're going to talk more about that too. Stress has a direct correlation with depression. Stress is disrupted a person's health coping strategies. So like a person skips their typical health mood strategy, resulting in further mood swings. So like stress, if I'm very stressed and I'm someone that usually goes to the gym, but then I don't go to the gym, that is going to cause mood problems for me. Early initial low mood symptoms generate further stress, either a major or small mistake. This could just be leaving something at home, which is stressful, and it could be led to depression. Stress can disrupt relationships. Stress can increase unhealthy coping, alcohol and drug abuse, and routines and structures may be disrupted. So I think this was a crazy thing when I was doing all the research on it. Like this COVID-19, we always talk about, oh, what is it going to be like after? Like this is the same thing with mental. It has long-term, short-term, and long-term effects on mental health. So I think you sent out an article to us that actually stated 1 in 5 COVID survivors got diagnosed with anxiety or depression for the first time in their lives within 90 days of the infection, which I thought that was a crazy statistic.
Yeah, for sure.
And an analysis of
do you think it's because they felt closer to death or realized the pain and suffering and it screwed something up?
Definitely that for older people, but like even people our age, if we get it, we're stuck in the house for 2 weeks. You know, that's a crazy thing to think about. There's nothing really to do. You know, you're in your room, you're locked in your room, you can't go out, can't see your friends. It takes a toll mentally on them.
Yeah, continuing off that just a little bit, I think another part of that for kids our age is if they are stuck in the house for 2 weeks and they had COVID, then when they go back out, many people probably aren't going to want to be around them right away, just with the scared thought that they might still be carrying it, even though they're medically cleared by the hospital or doctor to leave the house. I think that could be a part of it, is that like, oh, you had COVID 2.5 weeks ago, like I'm probably just going to keep my distance. And it might not just be because it's a me and you thing. It might be because I live with my grandma at home, and 2.5 weeks, just seeing you for a day after 2.5 weeks really isn't as important to me as making sure like my grandma I live with or my parents I live with stay safe, I guess. I think that's probably a reason.
Like an outsider.
Yeah, I think that's a reason that it spikes for a lot of kids our age. And then obviously for older people when they have it, I do think that it probably affects them more, because if they do survive it, they know like the pain and suffering they've been through, but they also don't know if someone like some of their friends their age or some of their family their age gets it, what could happen to them, which I think is another scary part for them.
So now we talk about an analysis of a physiological toll on healthcare providers during outbreaks found that physiological distress can last up to 3 years after the outbreak. So now we're talking about healthcare workers. You know, they're in there, they're on the front lines, they're seeing all this stuff, all these people die, and this stress on them can last up to 3 years after the outbreak. So one of the good things is Governor Cuomo, one of the hardest hit states, recently announced plans to expand mental health services across the state for frontline healthcare workers, which I thought was a very good thing. That includes launching an emotional support hotline requiring health insurers to waive out pocket costs for in-network mental health care. And that was short-term impact of this would be, you know, I guess not short-term, but it could also be long-term, is job loss and income insecurity is have a long-term mental health impact on you. And
do you think this impacts low-income workers more than high-income workers?
Definitely, because you know I'm actually writing a paper on white privilege being able to work from home, while like other races might not have the ability to work from home
by the nature of what they do.
Yeah. So I found like this definitely affects the low income community more.
Which then there's an adverse impact on people of color.
Definitely. I think we have a statistic on that in the slide. An analysis study projects that based on economic turndown, an additional 75,000 deaths due to suicide and alcohol or drug misuse may occur by 2029.
I think that's a very scary and interesting stat. I mean, obviously it's a projection. We can only hope that number continues to lower and lower if we get this word out and we get people their help. Like, it's a big step in the right direction with Cuomo telling all the healthcare workers, like providing all those services for the healthcare workers, because in some people's eyes, like the healthcare workers should be the ones that don't deal with these problems because they know how to deal with it, how to avoid it, and like where to go to help it. So people probably don't think that they deal with the same issues that the people they're helping are. But that's definitely a step in the right direction. And I guess we can only hope not hope, but we can only do our best to get the word out to make sure those 75,000 deaths start to decrease year after year. And hopefully we can get that down all the way to a very, very small number.
This is in addition to the quote baseline
Correct.
death. Okay, so this is incremental deaths.
Yeah, this is deaths based on like, because of what's happened with the economy during COVID, they think that 75,000 more people will start to get into alcohol or drug misuse based on their situation in life, having taken a huge downturn during COVID, which is a very sad stat.
Yeah.
But I mean, it's very visible. I mean, we all know people who have taken this virus harder economically than others. So you never know what someone's situation is, and you can never judge. You always have to be there to help them if they're struggling, and try and pick up those like ideas they're giving off that they're struggling.
Mental health risks due to job loss and income insecurity. So we know that, COVID-19, you can die, and that causes a lot of mental health problems. But another thing is you could lose your job. So COVID-19 has led to millions of job losses across the country. And the unemployment rate in February 2020 was below 4% about. And the pandemic's peak unemployment rate in April 2020 was 14.7%. So that's a crazy statistic to see. And research shows that job loss is associated with an increase in depression, anxiety, stress, and low self-esteem. Also, suicides may increase. And an example of this is back during the Great Recession, the unemployment rate rose to 10%, and it was associated with an increase in suicide rates. So we're seeing from past, unemployment rate increases that has a direct correlation with suicide. And a study showed that households experiencing job or income loss during the pandemic have reported an increase in stress compared to households that have experienced greater stress compared to the households that have no income or job loss.
Sure.
Yeah, using that Great Recession stat, we can go back to the one we were just talking about, where economic downturn, they're projecting those 75,000 deaths, and we see a real life example of what happened during the Great Recession when the unemployment rate rose to 10%, and that's still 4.7% lower than what it is now. So if that's 10,000 deaths, who knows what it could be for us. But again, mental health is more predominant now in society, and more people know, so we can get that help out and get it to the people in need. Okay, so we thought one of the big topics of this would be mental health on students. Obviously, us being students, we had an idea of what went on here, but it was very interesting to research just the statistical matter. So throughout our research, I realized that students did have an overwhelming increase in mental health issues during COVID. One of the surveys I had looked up and researched, there was 195 students surveyed, and 138 or 71% of them indicated that they had increased stress and anxiety due to the COVID-19 outbreak.
Above what they had previously.
Correct.
Oh.
Is it increased stress and anxiety? And there's another chart that I'll show later with increased stress and anxiety, like factors that you can realize that it's coming on. So this survey kind of realized the main factors and asked the people about what factors they had been feeling. So the main factors were one, again, like Nick had talked about, fear and worry about their own health and of their loved ones. This was the highest percentage. 177 of those students said that they felt this worry about their own health and of their loved ones. And I know I can connect to that one, because being away at school, worrying about your own health is one thing. When we're 20-year-old college kids that more often than not very healthy, but when you have to worry about the health of your loved ones, of your parents, your grandparents, even great-grandparents at home, when I'm 4.5 hours away and I can't really talk to them every day, I can't see them every day, it's kind of difficult to just let that weigh on your mind, because you don't know who they're seeing, where they're going, so you don't know what their risk of getting it is. Difficulty in concentrating, this one is more to do with school. That was 173 students said yes. I also agree with this. It's very tough to concentrate, whether that's just because it's online or because you're struggling with a mixture of these factors already. Disruptions to sleeping patterns, again, like Nick talked about, there was 168 of those students. Decreased social interactions due to physical distancing, 167 kids. I think this is a big one because college, especially for these college freshmen and sophomores, when you're in the dorms, that's kind of the whole feeling of college is your mental health increases because you're making these new friends, you're meeting new people, you're joining clubs and stuff that are making you happy. You can do whatever you want. You don't have to join a certain club. You don't have to be friends with a certain person. Like, you're making these decisions to make yourself happier. And I know the dorm regulations this year were 125%. So you could, in a 2-person room, you can only have one more person. And just that decrease of social interaction, I do believe, is very tough on students and very draining.
On everybody.
Right. Absolutely.
Yeah, and Zoom isn't the same thing. We can interact, but it's just not the same thing.
Right. Yeah, absolutely. And then increased concerns on academic performance. I think, as with 159 students saying this, I think this is kind of just a wrap up of all the other factors that go into this. If you're worrying about your own health, your loved one's health, you're having difficulty concentrating, you can't really fall asleep on time, you don't have a good sleep schedule, and you're losing sleep over not making as many friends as you should in college, not hanging out as many people as you can. I think this all kind of correlates into how you do academically.
Do you think you'd both be in this category? That all of these you probably would have answered yes to? It's more increase.
I would say so.
Yeah, definitely.
Yeah, I'm an extrovert, so I do love social interaction with people. And like, I enjoy class. I enjoy being around people, talking to people about the subject in class, even talking with professors after class or in class. So to me, that one's really tough, not being able to be face to face with somebody. I mean, with Nick, if I was doing a project with Nick, me and him could just either go to my house, his house, or go to a classroom and get the project done. But yesterday, like, he's still in Geneseo. Now I'm at home and we should be at school and we're FaceTiming. So it's just different in that way. I mean, obviously everyone's been affected, but I would agree with just about all these.
Yeah. I think elaborating on the decrease in social interactions, this is time. It does definitely affect everyone, not just college students and high school students, but these older people, it's time for the holidays, and that's usually when you're with your family, you're with everyone, you're supposed to be, talking, and you can't do that anymore, because the risks, the health risks, and that takes a toll on people's mental health.
Yeah, for sure.
I mean, I could see that firsthand. I had my grandparents over this weekend for the first time in 7 or 8 months, and they came over to watch the football game, and we wore masks in the house. They wore masks in the house, and it was just, you could tell it was taking a toll on my grandma and my grandpa because they just love interaction with their family, and they were very happy to be around us for the first time in 7 or 8 months. But still, we were wearing the masks, and you can't really hug or talk. I mean, get like all that close and just talk to your grandma for hours without a mask. So I think that I could see that one firsthand, that it's not just students handling it, but it's people of all ages. So the next one we had was mental health in the workplace. This was another interesting subject we had talked about earlier, and we figured we would go into more depth on. Mental health can get in the way of you doing your job to the best of your ability. With this being said, this may affect your effectiveness, morale, and communication, which in the workplace is huge. You have to be effective. People with high morale tend to get more work done, as it's just pretty obvious. And then without communication, I mean, that's how the business goes around. Everyone has to be communicating on the same page, especially now with everything being online and emails and Zooms. If you're not communicating to the best of your ability, it's going to be tough to get your job done and get other people's job done to the best quality that it could be. So don't brush it off. Like, talk to your manager, advisor, and see what they can do for you. Now everybody knows about mental health. Everyone takes it into consideration. So, well, they should at least. But especially with Cuomo taking that first step, I think that'll open up a lot of eyes in the workplace to take those same steps as him, because if it's a New York governor mandating it for his New York State workplace. I think a lot of places should follow in his footsteps. The workplace has been thrown for a loop and everybody's in the same boat. Asking for help is not a sign of weakness. This mental health being a sign of weakness has been a stigma for a while. So again, with opening up these new ideas and places for people to go, that like if you talk to your manager or advisor, I think that this could be a big step in the right direction if people don't have to feel embarrassed or like weak that they're going to ask for help, because everyone's dealing with the same problems, especially now, as we've seen, all the statistics are very much higher than they always were. So
maybe this pandemic has done good in that it has refocused our efforts on behavioral health, and that it's like accelerating the acceptance of it, which long term will have a benefit.
Absolutely. I think that that's a huge part of it, which is why I'm glad we could do this presentation, is to get more people to know. I mean, the more you know, the more you can help. And then when you know more, you can help more people know more. And it's just kind of like that chain of events that will just open up and kind of break down that stigma, which is what we're hoping to do. And then just to end it, 61% of workers that were surveyed during COVID said their productivity was affected by mental health. And actually, this was pre-COVID, I'm sorry. So we can only imagine what that number is like now with COVID. So I'm sure that a lot of people's productivity was affected even more by mental health. Because if you're working from home and you're stressed or you're depressed and you're not seeking help, and you're laying in bed, and it's just as easy to go back to bed as it is to get up and go to work. So, I mean, when you're dealing with those things, when you're dealing with the demons, it's not that easy to just brush it off. So you have to try and seek help and don't try to just shove it under the rug.
Yeah, I think it's a good thing. Don't put it under the rug. Don't try to say, yeah, I'll deal with it, when in reality we probably
by pushing it off, it just builds and builds more and more in your head, and then
so almost the first step is acknowledgement.
Right. Absolutely. So here's a few statistics. So I found another tracking poll that was conducted basically 2 months into, I think they started the stats late March or early March, and it's gone on until now. They keep updating every 2 weeks. So this tracking poll conducted in mid-July, so in the midst of it, that 53% of adults in the US reported that their mental health has been negatively impacted due to worry and stress over the coronavirus. 53% of adults, I mean, it seems like it's relatively low when it's 1 out of 2 adults, but that is however many million adults that it's affecting every day. If you're dealing with something, the odds are that if the next person next to you is dealing with the same thing, so not just you, it's not 1% of adults, it's not 10% of adults, it's 53% of adults. This is significantly higher than the 32% reported in March, the first time this question was included. So that was early pandemic, I mean, as early as it gets in March. And then in the midst of it, it's rose 21%, which is a huge number.
And it looked like in July, things were calming down a little bit.
Right.
So it's probably even higher now.
Right. And actually, I have a chart and a couple more sentences that I can show you the phase 1, phase 2 of it. As Nick was mentioning earlier, this was just an interesting stat that we figured out, is that there is a 55% increase in alcohol use, and there's a 36% increase in marijuana use. I believe that was for adults from the age of 40 to 53, but I think that number would increase in most people over the ages of, I mean,
legal
21.
Drinking.
Yeah, right. But
not that it wouldn't, but again, those that are non-legal age could still suffer from or deal with the same thing.
Right, that's what I'm saying. I don't think that it just starts at 21. I think kids that are underage and already drinking, I think they're probably drinking more with all the school weighing down on them, especially if they've dealt with death or hardship based on COVID from their family. You never know how they cope or anything. So
it just shows you now, like, instead of, seeing someone, most people are coping with alcohol and drug use, which you don't want to see.
Right. So here's a cool chart I found from the CDC. It was about anxiety and depression. It was a household pulse survey. So they included like a couple questions each household and kind of figured out the frequency of these anxiety and depression symptoms. It's kind of small. I'm not sure if you guys can see it as well as I can. But so as we were talking about just a little bit ago with the dates, this one starts on April and it kind of has the phases that we've gone through. So phase one, when we got to like June and July, let's say for college kids or young adults, the numbers started to grow early on. As soon as it started happening, we see this increase from here. And then it grew all the way to 45.7. And then from there, when it got to June, when things started to look like they were cooling off, like we were just talking about, it did drop a little. But then back in July, it reached an all-time high of 47.1. And then it only got higher from there, going to 50% and increasing all the way until now, where it's at 51.4%. And it was at 54.6% of people 18 to 29 even reporting these frequency symptoms. And that's only the people that will report it. There's always the people who won't report it because they think that it's mental weakness and it's embarrassing to report it. So
right, and we look at it, if we go down, it's by gender.
Yeah,
if we go to November 20, we see the gender. Yeah, more women. Yeah, yes. And then we got to be macho.
Yeah. I don't know why this got faint, but if you guys can still see it. So yeah, the male, let's see, the male started with, I think I was looking at this number yesterday. It started with around 24, 25%. Mm-hmm. And meanwhile, the female started with 35%. And that's already a 9% increase in women, not increase, but 9% gap between women and men, right as like the pandemic was starting. And then now if we follow that number, all the way over, we see that it's gotten all the way to almost a 12% gap, where they both have increased, but it seems as if females have increased more than males, which is interesting. I know when we spoke about this earlier, when we were talking about the project in its early beginnings, we recognized the point that it seems like females have a higher percentage than males because males are supposed to be macho and not have to deal with these things. But I think that definitely plays a role in it. I think that this number would be a lot higher if it wasn't for men having to be manly and not show signs of weaknesses. So that's what we can hope to recognize, that we don't want this number to increase, but we want to hear the true stat. So by getting this out, people will realize that they can get help and let people know that they're dealing with it. So we'll see the true stat.
Mm-hmm. And we can see some of the same things when we look at it by race.
Mm-hmm. Right. Yeah, the same things they have down
ethnicity.
Yeah.
You see, actually, Latinos have the greater amount through the phases when looking at it.
Yeah. Yeah. So the white single race, about 31%, and then the non-Hispanic other races and multiple races, 37%. So that shows a little bit of what Nick was talking about earlier with that stress. Some of it correlated to working from home and whatnot, as he said before. It definitely plays into this 6% gap.
Yeah, but if we look at, just hold it there for a second. So if we're looking at non-Hispanic white race, in August it was 31, and now it's at 36, so that's up. Right. But look at the difference in how Hispanic and Latino went up proportionately, went up more.
A lot higher, 12%.
Yeah, as right, well as Black and non-Hispanic other and multiple.
Right, and that's only in from August to November. I mean, we can go back to the start. So it ended at what, 45%?
Mm-hmm.
See where that number started. So we were looking at Hispanic or Latino, correct?
Mm-hmm.
Started at, well, at one point it was at 30.7. So that's up to a 15% increase. And then, why is this thing stop moving? Yeah, 30. again, that was in June when we figured, when we were talking about things were cooling off, it kind of hit a low point there, but it started all the way at 33.4. So yeah, that's again, a 12% increase, which is
That's
not something to brush off.
right.
Yeah, and every group is increased. I mean, we saw
Everything is increasing, but we're finding is that certain ethnicities and race are impacted more.
Yeah,
right.
You find the Hispanic and Latino and the non-Hispanic and Black single race, they are significantly higher than compared to the the white single race and the Asian single race.
Another interesting thing I thought about this chart was they split it up by state. So yesterday, when I was looking at this chart, I figured I would look sort of by the states that were hit the hardest and the states that really don't have as many factors as others. So I decided to look at New York as one of the states that was affected most by this, and with the lockdown and everything and all the shutdowns we've had. I think that is a fair statement that we've been hit by it hardest, or one of the hardest. And then I decided to look at Florida because right now it seems like they don't really have any regulations. They're just kind of wide open. So I figured that the number would be a little lower in Florida. It didn't really have as much of like a distribution as I figured it would between the two. But like here, Florida started with 32%. New York started with 36%. So that's already like a disparity between the two. But then when we end it, New York ends with 40.7%, and Florida ended up with 38.3%. So it's not really as big of a gap as I figured, but still 2.8% when it comes to the population of New York and Florida isn't a number just to not offer or not recognize. So
I think
I thought that was interesting.
A correlation with that could be New York. Yes, we're not open. We're shutting down, and people are losing jobs. Small businesses are closing. But in Florida, they're more worried about. Yes, they are open. They have all these places open, and people aren't wearing masks down there. So people are stressing there with their health, their actual health with the coronavirus.
Yeah, it would probably be pretty interesting if they did the states based on age, because I think like a state like Florida, I think that this age group would definitely be low because they don't have much to worry about. I mean, all their colleges are fully open, their high schools are fully open. They're doing their governor basically told them to go back to partying and whatnot. So I think that number would be relatively low because they're not really worried about it affecting them, even if they do get it. But I think that these last couple age groups would be a lot more, a lot higher percentage in Florida, like a state like that where it's open, especially because a lot of people move down to Florida when they're set off in life and they retire and want to just go peacefully live there. So I think that number would definitely be higher.
Okay, good.
Yeah, I thought that was a cool table that broke it down into a lot of different gaps that we could learn from. Let me see if we can go back to. Okay, so this was one of our last slides. We wanted to just talk about what to do if you are experiencing these mental health issues. Me and Nick kind of broke it down into 6 steps we thought would be the best way to approach it. After we researched, and we even talked to a couple people that deal with these mental health issues based on a daily basis, and this is what they kind of told us to kind of bridge it off. Step 1, as we talked about earlier, would be to acknowledge it and accept it. It's not weakness. You're not manly. You're not like embarrassed to show it anymore. I mean, everybody is dealing with it, and the only way that you can help it is if you acknowledge it and accept it to begin with. 2, talk to somebody you can trust, whether this is a friend, family, even family friend, just whoever you feel that trust with, that they're not going to go yapping their mouth about what you're dealing with and whatnot. Talk to them. You never know if they're dealing with the same issues, because if you talk to them, then they might open up to you, and there you go. Both of you are on the same track going forward. 3, let them know you are struggling or in need of help. Again, that goes with talking to somebody. You have to tell them what you're struggling with and what help you need, because this will help them get you to the right professional, which is Step 4, find a professional that can help you. These people are trained to help you. They're not just any people that are just going to talk to you and try and make up ways to help you. I mean, they go through training, they're certified. They're the best people what they do to help you and make sure that you overcome these issues. Consider exercise or meditation. Exercise is great, and exercise releases endorphins, which help you mentally. Those are great for your mental health. Meditation obviously just kind of helps you become zen and relax, and that can definitely help you if you're dealing with stress and depression and whatnot. And then last, the hotline is always there. It's 24/7, no charge, no nothing. 1-800-622-HELP. You call this number and you'll receive help immediately. That is a great way to do it if you don't want to talk to somebody that you know because you don't want anyone else knowing. These people are confidential. You don't know them in person. They can help you get to the right person without anybody else knowing if that's your issue. So again,
the hard step we feel like for people is that first one, just to acknowledge it and accept it, because that's something a lot of people don't want to do.
Absolutely. And that's why I thought this was a cool graphic, is that everyone's kind of linked together and it says it's okay to get help, because in real life, if this person's struggling, if all three of these people are struggling and none of them reach out to each other, then they're fighting their own battles. But this person reaches out to this person and all of a sudden they're talking about it, and they're finding people they can trust. They're telling each other about their problems. They're finding professionals. And then this person comes along and asks them about it. Then all of a sudden the three of them are linked and they're all helping each other. So you build that link, and then by people, this could also go into people knowing, as soon as we build links with everyone knowing, then we kind of reach our arms out to everyone else beside us and we can always help them.
And sometimes just once you acknowledge it and you know you have it, I think, as you said, Nick, that's the starting point.
Right. Yep. That's definitely the toughest step, is that
sure
telling yourself that it's okay. You do need help. You are struggling with this, and it's not out of the normal, especially now more than ever. So if you need the help, you got it. And there is a lot of places to go.
Right. And there's some things that we can actually do, like exercise, meditation, prayer, just talking to people. Sometimes you're not alone.
Right. Absolutely. That's definitely one of the bigger steps, is knowing that someone else is going through the same things that you may have not thought was going through the same things.
Excellent.
These are just our sources. We just link them up.
Perfect. Let me